Hello people, in this video let us look at Acanthosis nigricans. It is also called as AN in dermatology. Basically this is dark pigmentation of the body folds and creases. So particularly you can see in the neck because it is more visible area, right? So look at this photo. Here you have creases and folds, right, of the skin. There you have this dark pigmentation. You can see kind of symmetric, it is left and right, right? So this is the dark pigmentation. This is called as Acanthosis nigricans. Okay. So hyperpigmentation we told you, and velvety textured plaques symmetrically distributed left and right. You can see symmetry is there. So basically where you will see more neck, axilla, groin. Neck I will highlight because it is more visible part, right? So otherwise you can say axilla, groin. Then as the thing progresses, it can be everywhere. Now acanthosis, actually they are saying it is hyperkeratosis kind of a thing. It is not histological term, that's what the dermatology textbook says. The nigricans dark, and it is not because of melanin. This you should remember, it is not because of melanin. It is just the layers of the skin are more the upper layer, right? Hyperkeratosis, but it is not because of melanin. Okay. Then what did we tell you? Hyperkeratosis, right? Then when and all it can happen, most commonly it is because of insulin resistant state. Where will you see? Obesity, PCOS, what else? Type 2 diabetes, right? So type 2 diabetes mellitus, all that is insulin resistant state, right? This is the most common cause of Acanthosis nigricans. What you see here in this photo is the familial Acanthosis nigricans, and it can also be because of malignancy, which could be a gastric adenocarcinoma, like a esophageal cancer, stomach cancer, right? So that you should remember. So it could be because of malignancy. If it is because of malignancy, then this Acanthosis nigricans will be more extensive and pruritic, that is itchy. If it is itchy, if it is more extensive, if it is involving the mucous membrane, it can be malignancy. Which malignancy? Adenocarcinoma, that is gastric, esophageal or stomach cancer, you can say gastric adenocarcinoma. Then coming to the causes, we are continuing with the causes. We told you malignancy, insulin resistance, familial, etc. There is something as called as fibroblast growth factor receptor defect syndrome, if you can remember. And there are so many syndromes that the dermatology textbook lists as cause for Acanthosis nigricans. So you should understand that Acanthosis nigricans can happen in so many conditions. Okay. Then it can be drug induced also. So many things, like standard things that you write, OC pills can cause it. Okay. That is oral contraceptive pills. Then how will you treat Acanthosis nigricans? See, you should understand that the cause is what you treat, right? So if it is malignancy, you will remove the tumor. If it is because of obesity, you will ask them to take a weight loss. If it is endocrinopathy, that has something to do with your insulin, right? Then you will have to treat this insulin resistance by giving metformin, etc., which another drug that I have mentioned here. Cosmetically also, you can help the person by giving them some salicylic acid that will again help remove the hyperkeratosis, right? And some laser treatments also can be done for Acanthosis nigricans. So that is all that we wanted to cover about Acanthosis nigricans at MBBS level. I hope you have understood Acanthosis nigricans. Bye bye.